New York is the greatest walking and running city in the world, so it is especially important for New Yorkers to live pain-free, commuting, and enjoying what the city has to offer. Hi, I'm Daria Nichiforova at Loor Podiatry Associates. Today my guest is Dr. Jose Loor, owner and founder of Loor Podiatry. Dr. Loor, what is the vision behind Loor Podiatry?
Well, the vision of Loor Podiatry grew out of the passion and desire to treat New Yorkers' foot and ankle conditions with the most advanced podiatric care, regardless of insurance.
We're talking about New York, but are foot conditions widespread in the U.S.?
Absolutely. Most foot and ankle conditions are underdiagnosed and undertreated, such as ankle sprains, geriatric nail fungus, and diabetic neuropathy.
How did you start your practice?
I started the practice with a small business loan and some savings, as well as the desire to treat New Yorkers. And I chose Gramercy as my first location because it has the highest concentration of civil servants, such as police officers, firefighters, teachers, social workers, and it even has a Department of Veterans Affairs.
Dr. Loor, why these particular patients?
Because civil servants do so much for our community and I wanted to give back. They're always on their feet and they're always in motion. They're underrepresented in the healthcare system.
Dr. Loor, what sets Loor Podiatry apart from the rest?
It's our team of doctors. They specialize in different disciplines of podiatry such as wound care, trauma, sports medicine, and aesthetics. All of our doctors practice cutting-edge medicine.
What is your specific expertise?
My specific expertise is trauma and sports medicine.
How wide is your expertise? Do you treat just the forefoot or rare foot as well?
I'm a military-trained podiatrist, able to treat conditions from your knee all the way down to the tip of your toe.
Dr. Loor, what insurance does Loor Podiatry accept?
Well, this question goes back to my vision. My vision is to accept all patients and treat their conditions regardless of insurance. Our team of doctors are also available in different locations throughout New York City and New Jersey.
How many locations do you have, and what is the newest one?
Well, we have 7 locations. Our newest location is in Wall Street. We're the financial capital of the world, and it's really to treat everybody in the finance industry so that we're able to keep them in motion.
Are they prone to any specific foot trauma?
Absolutely. They wear dress shoes, and a lot of the corporate American or Wall Street population is very young and active. So they like to hike, they like to do extreme sports. So a lot of the injuries come from overuse.
What is new and exciting in podiatry today?
Minimal invasive procedures such as shockwave therapy, 10-jet or 10X to remove any of the scar tissues that they might develop over time, as well as stem cell rejuvenation.
What is shockwave?
Shockwave is sending sound waves through the soft tissue to break up any calcifications or scar tissue.
Who would be the ideal candidate for the shockwave therapy?
Well, all patients are candidates that have repetitive injury and have scar tissue or calcifications in their soft tissue secondary to trauma.
Who is a good candidate for PRP?
Well, PRP is short for platelet-rich plasma, which really takes your growth factors from your bloodstream, filters them out, and you can inject these growth factors into areas of injury for repair. Usually, it's based on age and health. So healthy young people are the best, have the best outcomes.
So what do you have for elderly people? Is there anything like PRP for people who are a bit older?
Or there are synthetic biologics that are in the market, as well as allograft biologics. Allografts taken from umbilical cord. The best graft, which is bone marrow aspirate, which is taken from your bone marrow. This is the best option for the geriatric population.
I see. You also mentioned 10-jet. What is that?
10X and 10jet are 2 companies that provide service using a needle or a wire to remove any scar tissue from a soft tissue area under ultrasound guidance. It's a minimal invasive technique that can definitely give you more motion.
I see. That's very interesting. What kind of condition can you treat with that?
You can treat conditions that develop scar tissue, such as overuse injuries or undertreated sprain injuries. Overuse injuries include tendinitis, tendinosis. Undertreated sprains are usually ankle sprains where the ligament has partially ruptured and developed scar tissue, which gets in the way of normal range of motion.
What are the symptoms for this condition? How do people know that they may have a tendinitis, for example?
Well, tendinitis is from overuse. Tendinitis has a lot of pain involved, and if you continue to have this motion, you can develop tendinosis, which is thickening of the tendon, as well as inflammation surrounding the tendon. And this could develop into calcification of the tendon or the covering of the tendon. Calcification makes the tendon very stiff and painful, so that if you're an athlete, it's going to decrease your performance, slow down your activity and your passion.
So what are the actual symptoms?
Pain, swelling, decrease in motion, that's the first usual signs the patient experience. One way to know that the treatment is not working is that somebody's already tried an over-the-counter anti-inflammatory, such as ibuprofen, or tried icing, maybe resting the limb, elevating the limb. Failure in resting the limb, icing, anti-inflammatories, and elevation can cause some concerns, especially if it gets in the way of your daily activity at work. If you can't ambulate or commute to work because there's a lot of pain, then it's time to seek help.
So how long is the recovery after this minimally invasive surgery?
The recovery is only a couple of days. Recovery is minimal because the patient's allowed to walk. There's minimal swelling as well as minimal bruising. Regular daily activities within the week, I would say going back to performance, usually takes about 2 to 3 weeks.
Dr. How do you feel about high heels?
I feel high heels are appropriate for certain events. Well, it's also occupation dependent. So if you're expected in your job to wear high heels for work, you have to find a way to minimize the amount of pain. So my recommendation is to not wear high heels during a commute, not wear high heels when you're sitting behind a desk, only wear high heels when it counts.
Are there any tips and advice that you can give to women wearing high heels every day?
Absolutely. There are stretches that women can do to stretch their Achilles tendon because their Achilles tendon is relatively shortened when women wear high heels. Icing the bottom of their feet, their heel, the back of their heel, the front of their foot, the ball of their foot.
Dr. Loor, what are the complications of wearing high heels every day?
Some complications of wearing high heels every day for women are bunions, hammer toes, inflammation of nerves that can lead to something called neuromas, Achilles tendonitis, meaning the back of your heel may hurt. Some women may develop something called a pump bump, which is basically an overgrowth of heel bone at the back of your heel when the heel rubs up against the heel counter.
What woman should expect if she's going into a bunion surgery?
Well, it depends on the severity of the bunion, of course. If we are correcting the bunion where we have to make a incision in the area of the bone, where we have to shift over the bone and straighten it out, bone heals in 4 weeks.
Are bunion hammer toes are the only conditions that women may develop wearing high heels, or there may be some other ones like ingrown nail, because I know some women have that too?
Well, certain high heels have a narrow toe box, meaning they're very narrow in the front and it looks like a triangle. This can cause ingrown toenails in the big toe or in the little toe. Sometimes a lot of repetitive trauma causes lifting of the nail. Mm-hmm. Lifting of the nail can allow normal flora, meaning normal microbes that are found in shoes, to become opportunistic and find a home underneath your nail bed, causing you to have nail fungus.
I see. Is there any therapy?
The most advanced therapy that's not too invasive, that's minimally invasive, is laser therapy. Laser therapy requires you to have multiple sessions through a certain period of time. It doesn't require you to take any medication that can be detrimental to your health. They can cause side effects, such as yellowing of your skin and things like that, or increasing your, messing around with other medications that you're taking, especially if you're diabetic or have problems with high cholesterol. Laser therapy is very safe and it's very effective. If you just notice there's a change in your nail, from wearing high heels or just overall wearing different shoes, come and have laser therapy. We offer it in all of our offices.
Thank you, Dr. Loor, for sharing your vision and passion. As you can see, at Jose Loor Podiatry Associates, we are dedicated to keeping New York pain-free, which means the greatest foot and ankle care for the greatest city in the world. For Jose Loor Podiatry Associates, I'm Daria Nichiferova. Until next time.